Hi, good afternoon, everyone, or morning, depending on where you're coming in from. We're going to give just a few seconds for people to come on in, and then we'll go ahead and get started. As Elena mentioned, we'd love to hear where everyone's coming in from. So, in the chat there, please let us know where you're calling in from or checking in from today. Wow, we have people from all over the country. That's definitely good to see.
A few of my colleagues checking up on how I do in this webinar, I suppose.
Keeping you honest.
That's right. That's good. Yeah, it's really kind of clear across the country here, right? This is great.
Yeah, yeah. Well, it looks like we have a pretty good number of participants here, so we'll go ahead and jump on in and get things going here. So, welcome everyone to today's webinar, which is on the power of peer mental health support for non-traditional students. My name is Melvin Hines, and I'm the co-founder and CEO of Upswing, and I will be co-hosting today's webinar. We're going to be going over a little bit about Upswing's mission, talk about just the overall importance of mental health and holistic student support services for students, and then we want to transition to talk a little bit more about how impactful it can be for peer support to specifically support students who uh, don't typically tend to have that traditional on-campus experience. Uh, I then want to introduce my colleague here, McEvoy here with Togetherall, and he'll share a little bit about some of the things that they're doing, and then we'll open it up for questions. So without further ado, just want to give a little bit of overview of Upswing. So, for those of you all who don't know us, we're based out of Durham, North Carolina, and our whole focus is on providing online student support services for students who are historically marginalized and underserved. What we want to be able to do is create those same levels of support resources that I recognize were challenges growing up in South Georgia. And I saw quite a few of those students who were having those challenges end up resulting in students dropping out, not graduating, not being able to better their lives and their families' lives. And so what we wanted to be able to do was create a resource that could help to provide more of that support for students. And this is a big part of the reason why we are targeting these types of students here that you'll see here, is because we recognize that all across the country, and really the globe, you can identify some of the challenges that many of today's students are going through. Many of the students who are coming to college today are coming from households under $30,000 a year. An increasing number of students are having to work while in college, or take care of either aging parents or take care of their own kids who are students. We're noticing very increasing numbers of online students, students of very diversity, and so we want to make sure that we can help to support those students as well. And that's a big part of why we wanted to create this experience here, where we can talk a little bit about some of the things that we're noticing, particularly when it comes to mental health for non-traditional students. The overall impact has been that we've helped to retain on average about 78 students per college per year. We've helped to prevent over 75,000 students to date from dropping out of school through these various wraparound student support services. That's certainly something that we're really proud of here. And a big part of how we're working to deliver that impact is by working to specifically create tools and resources that are impacting some of the biggest reasons why students say that they've dropped out of school. Today, one of the big ones that we want to talk about specifically is the one here in the middle. Um, as we all know, especially since COVID, but even before then, there has been a large prevalence of just mental health needs, mental health challenges that have been taking place. And this number is increasing, not decreasing. And what we want to do is make sure that we're creating tools and services and resources that can help to support all students who are going to campus, not just those who are able to get to, say, the counseling center during the times that they're available and open there. In fact, what we've noticed, or what we've seen, is that particularly among certain types of students, we're seeing that they're more likely to have clinically elevated depression systems, as well as elevated anxiety and suicide risks. And those specific groups of students are tending to skew much more likely recently to be people of color. Um, they also have noticed that those types of factors are contributing to things like microaggressions. Um, that they're contributing to the mental health needs are things like microaggressions, discrimination, imposter syndrome, and negative campus climates. And so, what we want to make sure that we're doing is creating a pathway and an opportunity for people to open up about some of those challenges that they're having here. Here's an example of just a specific conversation that we had with one particular student. Um, our virtual assistant, Anna, that you all have probably heard about before, reaches out to students proactively to ask how they're doing. Is there anything that they need additional help with? And tries to create encouraging messages. In this particular case, we had a student who reached out mentioning about how they're trying to stay focused on school, but all these other challenges are keeping them from being able to feel connected anymore. That they've lost loved ones, um, that they're dealing with other challenges that are happening outside of their academic environment. And these are the things that today's students are dealing with on a regular and recurring basis. And so, what we want to do is ask the question, how can we not just keep them there suffering in silence and not raising their hand, but how can we proactively reach out to them, let them know that their entire community is there to support them. And even if they're not able to meet physically to get support, they can go virtually to get that support as well. And that's a big part of the reason why peer mental health support is such a key aspect of the overall mental health ecosystem. Because a lot of times it's really that first step, right? It's them being willing to tell someone who is like them or who maybe speaks their same native language or who has gone through some of their same challenges about what they're noticing, what they're uncovering, what they're dealing with in their day-to-day lives. And from that, we might be able to get them to take the next step to increase that level of mental health support and feel like it's okay and they're not the only person who's having to deal with those challenges. And so that's a big part of the reason why we're really excited to partner with Togetherall. Um, I had an opportunity to meet with Matthew last year, and we talked a lot about having similar experiences and similar passions that drove us both to create our respective organizations. Um, and Matthew told me a little bit about the ways in which they are supporting their students through the Togetherall system. And it just seemed to be spot on with what we've been looking for. And so I'm happy to turn this over to Matthew. I wanted first to share a little bit about his background. As the CEO, McEvoy leads all aspects of Togetherall's strategy, operation, and growth. Matthew has spent his career in digital and remote-based mental health care. Before Togetherall, Matthew spent 13 years with a global mental health service provider, focusing on building various digital mental health programs in higher education and public and private workplace settings. And so I'm really excited for you all to get the opportunity to hear a little bit more about Matthew here, hear why he built what he built and what the importance has been, especially since COVID, especially now. So thank you again for joining us here today, Matthew. I'll turn it on over to you.
Great. Yeah, thanks a lot, Melvin. Yeah, nice to be with you here, and we're really excited about this new collaboration and partnership with Upswing. As Melvin mentioned, I think, from the first point that we met, and Melvin and Elena and the team, it certainly felt like we were sort of kindred organizations, and with a lot of the same kind of mission driven nature of what we've been doing. Just by way of kind of further introduction, I'll tell you a little bit about how I wound up at Togetherall. So, as the slide says here, I've spent the last 20 odd years of my career in mental health service delivery in one way, shape, or form. As Melvin mentioned, I prior to joining Togetherall, I spent a good 13 years building specifically a one-to-one counseling support service for students. And during my time doing that, it struck me that no matter how many clinicians we hired, no matter all the different methods of one-to-one support we offered, we could never really meet the demand for treatment via those traditional methods that were coming from our students who were accessing our service. While we sort of grappled with this issue over a number of years, we were continuously hearing feedback from the students that we were serving that they wanted to be a part of the solution. And so hence this light bulb moment of peer support. And while I was there, I set out on a search for an organization to partner with related to peer support that could deliver peer support at scale to help support the students that we were seeing call in to use the service. And I came across Togetherall, and a very long story short, rather than a partnership, I actually joined the organization 6 years ago as our first employee in North America, and was really struck by, and still continue to be struck by, our mission around providing what is a true population level mental health support that dramatically increases both access and impact on those we serve. If you want to flip to the next slide there, Melvin. So at Togetherall, as it says on this slide, we've built a digital, clinically moderated, peer-to-peer community where students who are struggling with their mental health in one way, shape, or form can support one another in a safe environment. We were actually founded 18 years ago, the same year the smartphone came out. So we've been at this a good long while and seen obviously massive change in the technology landscape. And actually, we were founded as part of a grant in the National Health Service in the United Kingdom. Think about back at that time in 2007. This was around the same time Facebook was cresting. And we were tasked with developing a way to harness the demand and interest in social connection to reach more and different people around their mental health than were coming to seek support in person in the National Health Service, seeking traditional one-to-one mental health services for a whole range of reasons, right? Whether it be access or stigma, particularly amongst marginalized communities in that space. We moved quickly from working in the NHS to moving into higher education, and are now working with nearly 4.5 million students at 450 institutions. So the mandate has really ballooned, and we've supported hundreds of thousands of students. We talk about a little bit more about Togetherall specifically. We talk about Togetherall being a safe community because it's monitored and moderated 24 hours a day by licensed clinicians. And our clinicians really play one of three roles in the community. The first is it is a mental health peer community or effectively social network. There will be discussions around things like self-harm and suicide. We don't shy away from that. We have our team of 60 licensed clinicians who monitor that and jump in when there's risk and get that student who is at risk connected with crisis services or emergency services as needed. The second role that our clinicians play is to moderate or connect students with one another within our space and help find another student who's going through something similar to what they're doing. And then the third is we guide students to more intensive levels of care available to them either through their campus or in the broader community. And so those clinicians play a really significant role in making sure that this peer community that we built is safe and supportive. The last thing I'll say about Togetherall specifically before I jump into sort of peer support in general is that the service is anonymous. So students join using their .edu email address or through SSO with the institution, and then they create an anonymous username. So our clinical team will know who they are, but all the sharing and supporting that happens in our space is done anonymously. And that's really been critical to the success of the support that we've been able to provide. It offers kind of reams of benefits, the most important of which is right here on the slide, is that 92% of the students who use Togetherall are not seeking mental health services on campus. And we'll get into a little bit more around the data in a few slides. But part of the way that we serve non-traditional students is this idea of anonymity and creating a safe space for them to come and get access to support. I'll flip to the next slide there. Melvin, I want to talk a little bit about community. So, you'll hear me use peer-to-peer and community sort of interchangeably, but we think about what we've created as an online space for people to get connected and create community in case they don't feel like they have it. We know that community has long been a force for good when someone is struggling. There are countless examples of when communities come together to support people in need. A couple of examples that jump to mind are things like Alcoholics Anonymous, or when a loved one is diagnosed with cancer alongside a course of treatment, we see often that they're referred to a community of cancer survivors who know what they're going through. And that will be, alongside a course of treatment, of course, will be what gets those people through that really difficult time. And at Togetherall, we strongly believe that that same sense of community support should be applied to mental health. So there's lots and lots of research about the power and efficacy of community support. We recently released a white paper around the empirical evidence of peer support in support of mental health that we'll happy to share around afterwards. But in short, the noted benefits of peer support are listed here on the left-hand side of the screen. Sharing, supporting, validation, normalizing, using a shared lived experience to support someone else, and a sense of belonging. Melvin talked already a little bit about COVID-19 and what we saw there, and in our community, a massive spike in loneliness and isolation and social anxiety. The data across lots of community mental health organizations and higher education mental health organizations is that there is a marked increase in social anxiety among young people attending colleges and universities now. But all of these things are really valuable outcomes of being a part of a community and have a positive effect on one's mental health. But we know that there are lots of things getting in the way of people seeking support of communities, right? When we see institutions standing up physical peer-to-peer operations on a campus, often we'll get one or two people trickling in, or there might be a few, or timing doesn't really work. And we know that there are lots of barriers for individuals seeking support. One of them, of course, is actually detaching themselves from your phone. But also there are some things in the literature that talk about, that are inherent to mental health concerns, right? Just like isolation and withdrawal, stigma or fear of judgment. This is particularly prevalent among marginalized students and non-traditional students. Just being able to access a building and a service at a particular time, or just access in and of itself, is a challenge, particularly as we have more and more non-traditional students in community colleges who are maybe working or parenting and can't find the time to get to traditional supports. And then also being aware that the thing you are struggling with might actually be a mental health concern or something called sort of mental health literacy. I think we've done a great job as a collective of breaking down some of those barriers related to stigma and mental health literacy, but we certainly have a long way to go, and some of the data we'll share later on, I think, will demonstrate some of that. And there are already places where people are going for online communities. The thing I'd say about digital communities, and I'm sure there's lots of opinions on this. There's obviously lots happening in the media with some of these social networks, mostly on the negative side. There are lots of positive benefits about some of these things. But as you can see here, the numbers and usage of communities for mental health specifically are astounding. In the millions, sometimes in the billions, depending on the kind of data that you're looking at, of people joining mental health groups, sharing about their mental health concerns on Reddit and Facebook and Instagram that are really quite striking. But when you put your institutional leadership hat on from a mental health perspective, I think the question is not should students be using peer communities? It's that each and every student who comes to your campus are using an online or multiple online peer communities. And this is really your starting place. None of these really have a meaningful approach to safety and support. And so I think the question is, should we as an institution provide a healthy alternative that is aligned with our goals as an institution values for students to receive good, informed support? I'm going to flip to the next slide. That's a little bit about community. When we think about the next step of support, it leads me to another concept that we talk a lot about at Togetherall, being a population level support for student mental health. I'll talk about a couple of key concepts here, but the key thing to take away related to a population approach to mental health is the concept of this funnel. At a population level, it requires us that we recognize that each and every person has a mental health need at one point or another. We have a tendency to sometimes pathologize those needs unnecessarily, but mental health concerns are really normative within the population. There are lots of campus level surveys and data that tell us this. The Healthy Minds survey, the National College Health Assessment, data from ACCCD and CCMH, to name a few. There is no shortage of data that tells us there is a significant number of students who could benefit from mental health support on campus. But from a support perspective, at the top of the funnel on the slide is our true population level supports, whereas the bottom of the funnel are intensive one-to-one in-person treatment or interventions. And this funnel approach to population level mental health says, let's give everyone in the population a baseline level of mental health information and support so that everyone can have access to those. Right? So each and every person, no matter your level of acuity, no matter where you are, if you're online, offline, remote, on campus, you can have access to good quality mental health information and support at that population level. From there, as you proceed sort of down the funnel, as a person has more in-depth needs in terms of treatment and acuity, we provide a smaller part of that population with more intensive levels of care. As we move down the funnel, services also tend to become more costly. And that obviously has a meaningful impact on the type of institution that you're with. So by institution, the level and depth of support that we provide towards the bottom of that funnel, that is to say, sort of the more intensive treatment options, really is going to vary by institution and your unique mission, resources, goals, stakeholders, and other limits. Something that our Chief Clinical Officer, Dr. Ben Locke, talks about as the clinical load index. Won't get into that concept today, but worth looking up at the Center of Collegiate Mental Health. So, the ability to provide those more intensive levels of care is going to really vary by institution and type of institution. A well-resourced private liberal arts college will provide a very different level of treatment capacity than a community college versus a large state school. But it's our view that no matter the institution or the level of financial resources of the institution, the basic mental health needs of your population should be attended to first and foremost. Historically, I think many institutions have viewed mental health support through a treatment first lens. And if we think about the number of students who actually need support, That's taking a really large population and trying to thread it through a very tiny needle, or an eye of a very tiny needle. So what does that mean in terms of alignment and actual support, right? How do you then take a population level and put it alongside sort of treatment? If you want to go to the next slide, Melvin. The next kind of concept we have here is really what we talk about as sort of a both and approach, and why a 24/7 digital peer-to-peer community makes sense. So if we believe in a population level of support should occur, then how do we really put these services alongside treatment resources? In brief, at Togetherall, our approach and our clinical leadership come from a grounding in clinical treatment. We strongly believe treatment is of critical importance, rather. But we also have to come to terms with the population and the need, which we cannot attend to at the treatment level. There are just not enough providers licensed in the US to attend to the demand that we're collectively seeing. And so we need to think about what other options or ways. And that's where this idea of the population level support comes along. And then our approach to peer community makes sense. Coming back to the support for non-traditional students and some of the challenges that they're uniquely facing also means that some of those students are not going to come ever to traditional face-to-face support on a campus or even in a community. And so having this idea of 24/7 online peer community can really make sense. So we strongly believe that to meet this growing student need, institutions both need to continue to grow one-to-one treatment capacity and resourcing within the counseling center, and also support a population in a way that's affordable. And that's where this idea of digital peer community can help. As I mentioned sort of in my opening remarks on why I joined Togetherall, there's also a strong demand for peer support on campuses from students themselves, but also from institutions. We get tapped on the shoulder all the time about how's an institution think about creating a peer support community on campus. But in increasingly, budgets are tight, enrollments are strained. There are financial barriers to creating your own peer support community on campus. And we'll talk about next is peer communities can have a really significant increase in reaching marginalized students who may not have sought support before. And that's where our data really backs that up. And so if we go to the next slide, I'll share a little bit more analysis of what we've done over the last little while in terms of looking at the students who are accessing this population level service and what that means. So what we've done is our Chief Clinical Officer, Dr. Benlock, and I have looked at a sample of the last 100,000 students who've used Togetherall and wanted to pull out some of the more interesting trends. I kind of gave away, I think what is the most interesting of those is that of those 100,000 students, 92% of them had not sought support on campus. And I think these sort of population level supports are uniquely positioned to be able to reach those students who otherwise wouldn't get access to care for a lot of those reasons that we spoke about before, whether it's just simple access, stigma, or just the willingness or desire to pick up a phone or wander into a counseling center to get some support. A further 65% of those students who joined Togetherall are actually not seeking any form of support at all, whether on campus or in the community. So we know that we're reaching a really different set of students than might traditionally come forward and raise their hand for support. We also know that we're reaching, historically underserved students, right? 55% of those students identify as BIPOC. And that looks, who we're serving looks very different depending on where we're seeing those students. So I'm Canadian. In Canada, a lot of the institutions that we see a much higher percentage of Indigenous Canadians, for example. In a lot of our US schools, we see a higher proportion of African American students, for example. So the who looks quite different depending on the type of institution we're working with. But what is the common thread is that it's the vast majority of students are not seeking support elsewhere. And it's also a good chunk of non-traditional age students. So about a quarter of those 100,000 students are over the age of 25 and come from a whole range of mix and backgrounds. They're parents, they're working, they're online, they're remote, they're on campus, they're off campus. But it really is an interesting mix there. One of the other interesting bits around population level support, I think is a bit of a misnomer, or peer support as a misnomer, is that it is only for early intervention. And it certainly can be because the anonymity of what we do, the 24/7 nature, the clinical moderation is often a first step for people who are just thinking about, something's quite not going quite right, and maybe I want to see what's going on in this peer community. But fully a third of students who join Togetherall are at a much later stage of acuity. So about a third of them have had thoughts of suicide in the 6 months prior to joining Togetherall. And that is one of the main reasons we have our licensed clinicians moderating the space 24 hours a day. And about 40%, or 2 in 5, are actually having some form of interaction with our clinicians, not just the peers within the space. The last part that Melvin touched on this a little bit around mission alignment between Upswing and Togetherall. We have a real focus on supporting students and making sure they do what they're there to do, which is learn and thrive and graduate. And fully a quarter of students who joined Togetherall have told us that they've had thoughts of stopping out, or recent thoughts of stopping out, and about a fifth have said that Togetherall has helped them remain enrolled. And over the course of 100,000 students, that's a really significant number. We're not saying that that's the only reason they remain enrolled, but given the level of support that we provide, the fact that most of these students are not seeking support elsewhere, we feel really confident and proud that we're able to have this impact. And then lastly is just the fact that it's working, right? Students are using the service, and 87% of students say that Togetherall has been helpful for their mental health, right? I think what we talked about earlier about the benefits of peer support, students receive that when they join Togetherall and are saying that it is helpful for their mental health. So that's just a little bit about us. Some of how we're supporting non-traditional students, and a little bit of background on population mental health and peer support. So I'll pass it over to Melvin.
Thanks so much for that, Matthew. Apologies about the little challenge there. I was trying to get the video back on and accidentally paused the slides there. Um, but yeah, I think that so many of the pieces here that you mentioned just speaks so profoundly to what we've been hearing and seeing for a few years as well here at Upswing, in particular when we started to offer some of our virtual assistant support services through Anna, and recognize that a lot of the students that were coming in had some of these exact same characteristics that you're talking about. Students who were identifying as being increasingly adult learners, increasingly people of color, and increasingly people who hadn't had formal outreaches to either therapy or teletherapy services. This was their first kind of foray into that. And so then the question becomes, how do we invite them into a feeling of comfort? How do we invite them into a circle of care that we know is so badly needed to ensure that not only are they graduating and succeeding on time, but also that they don't do something that's irreparable. I specifically remember the first time that through Anna, we received a message from a student that in particular talked about self-harm and it was certainly a wake-up call to us because, originally we were really trying to provide more of the just overall support services and referrals, but then you suddenly get something like this that everything else needs to stop, and we need to figure out how to support this student immediately. And so today fortunately we have escalation protocols, but that was certainly a big wake up call to us. And as you mentioned, this is something that certainly has been increasing over the last few years. And so I think it's certainly a big boon that you're providing these types of support services, not just with the licensed counseling and clinicians, but also with people that they can relate to and connect with as well.
Yeah, and I think that's the two biggest reasons why students feel compelled to join the Togetherall community is one is the anonymity, right, which breaks down some of those barriers we spoke about. And then the second reason they tell us is because it isn't clinical in nature, right? It
Mm,
feels a lot easier. And there's quite a bit of research that shows that often young people, particularly young people of color, are more likely to go to their friends before they go to a clinician, a person of authority, a professor. And so, but even those students are sometimes unlikely to even go to their friends, right? And I think that's part of the
right.
reason we created this environment is to welcome those students in.
Absolutely, absolutely. And I think one thing you know, that I think should be elevated even more is the fact that even though they're able to go to these peer support groups, um, that the role of Together All's clinicians plays a vital impact. That it's not that they have to actually go out, and seek this clinician, which might still be intimidating, even in an anonymous or confidential type setting, but that they're actually seeking out those who are talking about some of these subjects and topics and needs and concerns. Maybe you can share a little bit more about just how that role ends up working with your clinicians acting as moderators.
Yeah, our clinicians are very much a part of the environment, right? They're very visible. When a student first joins, they get a direct message from one of our clinicians that welcomes them to community, explains what our role is. We offer sort of a two-way back and forth communication path. So if a student has a question about the community or a concern, they can reach out to a clinician. And likewise, if we have a concern, right? So I said that 35% of students have considered suicide in the past 6 months prior to joining. The vast majority of our students are able to be contained within Togetherall,
Mm,
but 2 to 3 times a day, we have a student who requires an immediate crisis intervention, and
wow.
that's one of the kind of critical roles that our clinicians play. But actually, it's a really small percentage of what they do. A vast majority of it is making connections with students, asking questions, making them feel comfortable. They're very much a part of it. If you're to kind of go and scroll through, you'll see lots of our clinicians kind of dotted through the community and offering that level of support. It also offers, when a student is expressing something like a suicidal ideation or saying that they're actively, considering taking their own life or self-harming in some way, our clinicians respond very visibly, right? So if you go to some of the other kind of online communities, a subreddit for suicide, for example, you'll see lots of, people not really knowing what to do when someone writes something about that. Right. And
Right,
that's why we've
right,
got these licensed clinicians there to make sure that we're encouraging students who are contemplating those sorts of things to openly talk about them, but knowing that there is a safety net there of licensed providers who are going to help them. And then the other kind of key bit here, Melvin, is when we launch on a campus, it's also really understanding what services and supports are available unique to that specific campus. So when a student joins, they use their .edu email address, so we know what institution they're with. So if we see a student who's struggling, we already have collected in advance what services are available um, on campus, whether it's in person or virtual, or if it's a small community college that doesn't have any mental health services, what resources are available in the community, and how they like us to respond if there's an event of an emergency. And that's where that both and right of together all
absolutely.
alongside treatment even if there is no treatment capacity on campus, which a lot of community colleges that we work with, there isn't. That's a really kind of critical piece at the outset of our work.
Yeah, really, really great to hear that. And I think this is something that could definitely be a big benefit to so many folks who are part of Upswing's community for sure. And that's actually a big part of the reason why we wanted to create this partnership, is because we've heard certainly time and time again that this is something that so many, particularly of our schools, once again, I know I keep mentioning this, but since COVID, have been needing for so many of their students who are increasingly online, increasingly adult learners, and increasingly non-traditional. And so what we've been able to do with Togetherall here is make sure that we're incorporating that support as part of the overall experience that students can receive through the Upswing experience. We want to make sure that we're partnering with, some of the best tools and some of the best resources out there to create each of those different um, key critical points to help support students along the way. And this is certainly something that we're excited to offer as part of the overall Upswing experience that's here. Um, you know, Typically where we'll provide that is through our mental health module where there's already videos and things like that that are available for students. But we'll also make this a link that's available, an integration that's available for your students as well, if this ends up being something that could be of importance for you all as well. And so what I wanted to do is pause here and just see if there were any questions that folks might have for Matthew while we have him here. As you've seen, he has a wealth of experience and knowledge and understanding from just the research that's taken place over the course of the last few years about not just the importance of mental health, which I think all of us have recognized, but also the importance specifically of peer-based support as a contributor to that mental health. And so I'll just pause here and just see if there are any questions that anyone in our audience might have that we might be able to ask Matthew while we have him here. Oh, and I should also mention that if you do want to ask a question, there is a Q&A button around here somewhere. You should be able to see it. Or alternatively, you can put it in the chat and we can make sure to read that as well.
And just while we wait for some questions there, Melvin, I just offer that obviously there's many reasons why Upswing and Togetherall have come together in this way, and one of them I think was also just the advent of Anna, because it is where students are already going, right? And it's not necessarily, if we're thinking about reaching those students who otherwise aren't accessing support, we need to make sure that those students are aware of Togetherall in sort of non-traditional places, right? So, you
Absolutely.
know, we say 92% are not using campus services. That means 8% are, right? So we're getting lots of referrals um, to Togetherall from clinicians and counseling centers. But where we see the most is where we are integrated in key areas where students are already going, right? Like the Upswing environment in and of itself, like integration with Anna. Or Anna, I guess is the proper pronunciation, but it's finding those places, or like integration with the learning management system, like Blackboard or Canvas or Moodle or D2L, and making sure that when students are at that point of need, that they can get access to support.
Absolutely, absolutely. Um, and actually, I think that dovetails really well with some of the questions that have come in so far. So one in particular is talking about that level of support within and off campus. This comes from Caleb Shermer, who said, "What if a university already has a counseling center? How would this partnership increase rather than decrease the support that's already on campus?"
Yeah, it's a great question, and I think when we start talking about institutions about implementing Togetherall, it is that both and, right? Where does Togetherall fit within the mix of services that you have? Each institution is really different, and we've worked with some, one community college that had one counselor on campus for 40,000 students. We have others who have 2,000 students and 12 counselors, and everything in between, right? And so I think the beauty of thinking about where Togetherall fits is in that funnel of population level support on down, and offering Togetherall alongside a wealth of other resources, like a private liberal arts college might have, to a really sparse level of support where there may be no on-campus clinical services, and Togetherall kind of sits alongside because it does serve at that population level.
Yep, absolutely. And there's another question that has also come in from Amanda Thompson that says, uh, oops, sorry, just moving this box over a little bit. Can users come off of the platform, for example, with early career support, and then after graduation as well?
Yeah, absolutely. So, Togetherall, if you think about it, comparing it to, Facebook, right? That was the original kind of concept, was creating a safe, supportive version of Facebook to create connection. Our goal, rather than, Facebook's goal, is to get you coming back every single day, right? Because they're selling you, it's eyeballs on advertisements, right? We want you to come back to Togetherall as a student as often as you need to, such that you feel supported. It also means, you can use it for a little while and come off if you like, re-register and come back on, as long as the institution that you're with has the access to service. We've actually seen a number of institutions extend access to Togetherall sort of beyond graduation, for some alumni. So that's something that can be done. Um, Typically it's for active students, but we've seen it done that way as well. We know one of the best places to get mental health support is actually on a college campus, believe it or not. So it is something that we have done in a number of circumstances.
Yeah, and I can also imagine that that would be another one of those critical, pivotal moments is you're finally, you've gotten the degree or the credential, and now what? A lot of stress that kind of takes place there as well.
We didn't have much of a chance to talk about this today, but transition points are, obviously, we see a lot of that: incoming students graduating, students moving abroad, students switching institutions,
Hmm.
right? Those transition points are points of high need, and are often sort of very common themes that we see popping up in what students are talking about on the campus. So even incoming students, we've had a few institutions say, as soon as a student is accepted, let's make Togetherall available to them, even before they set foot on a campus, as part of, asking questions about what's it going to be like, if you're a first gen student, going away from home, or that whole experience for the very first time.
Yeah, yeah, I could definitely see that. That's a really good point to call out for sure. And then we have another question here from Magdalena De La Teja, who says, what do the colleges slash universities who are most effective in working with Togetherall do to support your partnership with them to help marginalized students?
Yeah, it's a great question. It comes back a little bit to awareness of the service. If I'm being truly honest, we are, while a population level service, we still are a point in need service. So it's making sure that Togetherall is there and readily available when a student needs it, right? We never know who it's going to be or where it's going to be. So we've seen lots of different institutions try all kinds of different strategies, but it is making sure that it is available in key places where we know marginalized students are going to go, whether it's Upswing on a learning management system, another student engagement platform you may have on campus, kind of key places in residence, training, student leaders or advisors who are going to be interacting with with those students and on, how to recognize signs and symptoms of somebody who might be struggling and how to effectively recommend or feel confident in recommending an online peer community like Togetherall can be sort of a few of the key ways. But when we work with a new institution, part of the role of our team is to really sit down and understand, what are the nuances and particularities of your campus that are unique and how do you best reach students? We know that a blast email often just goes to the trash bin, right? Students aren't reading those emails. So we're all about kind of finding creative ways to find students where they're at and then saying, hey, are you struggling right now? There's a community of students who are like you. Come and join us. And that's what we found to be most effective.
Yeah, absolutely. To piggyback on that, I think one of the things that we found has been making sure that awareness of the support, whatever support resource that is, whether that's, Togetherall, a campus resource, Upswing, is to make that resource as much as possible leaning towards just in time over just in case. Um, Usually when we're following more so along the just in case pathway, what tends to happen is students feel, they get flooded with we have this resource available, that resource available, these hours, that day of the week. And perhaps it becomes one of those things that becomes in one ear and out the other. But if we can create strategies and plans and protocols that make it easier to proactively engage those students and find them exactly as what you said, where they are, then we can get them when they're having those points where certain types of thoughts might start to um, you know, enter the chat, if you will, and we want to make sure that we can support them.
Yeah, I just have two other quick thoughts related to this question because I think it's a really important one, right? It's also in the language that we choose to use to describe a service like Togetherall peer community, and I think it needs to be in our experience over the years, the pieces that work best are sort of non-clinical language, right?
Mm,
Not are you depressed? Do you want to talk to a clinician? It is, are you feeling lonely or isolated? Or are you struggling? Or there's a community of support here for you. Sort of using non-clinical language has been, I think, super important in particularly engaging those marginalized students. The other piece that we have developed over the last couple of years is, part of the Together All program, which I've not talked about yet, is we've got a trained peers program. So the ability for a couple of students on campus to do an online self-directed training, join the community as a trained peer, offering their support under the supervision of our clinical team, essentially becoming Together All champions, right? So it's that lived experience that those couple of students have had, and then they can help spread and advocate the word for Together All on campus has been a very effective way. It is for students by students, and hearing from students who are directly interacting can be really powerful. It can be a
absolutely.
challenge because most students who join love it because of the anonymity. So this training program helps to kind of break down that
Mm.
part of it.
I think that's actually a really cool experience, and I think that might also help to answer this next question here. But I'll let you kind of expound a little bit more. So Kimberly Knowles wanted to, and Kimberly is one of our heroes here at Upswing. Wanted to ask the question: how do you see the work that you all are doing with Together all differentiating from some of the other resources, telehealth providers that we typically tend to see in the space as well?
Yeah, we very much work alongside, right? I think, I think when I talked about that sort of both and model, I emphasize what's happening on campus, right? For more traditional one-to-one services, but we very much work alongside other virtual mental health providers that are providing this kind of support sort of over Zoom or what have you, still very much complementary to that, right? It still takes, a very similar amount of energy or effort to even, pick up the phone and call someone. And I saw this in the previous organization that I ran, and also to say I need help and engage in a one-to-one discussion when you're looking somebody in the eye or even just talking to them. So this kind of peer support still works in that context. And I'd say down the kind of population funnel of virtual mental health services, sort of a step or two up from those face-to-face supports. So very much kind of complementary. In fact, we do a lot of integration with those kinds of platforms as well, where someone accesses there and maybe clinical services aren't for them, could come to Togetherall and vice versa, right? Get step students up who need more to virtual care if they need it.
Absolutely. Well, Matthew, I really appreciate the time that you took to just give a little bit of an inner look into what led you to come to Togetherall. Also, with some of the insights and informative data that you all have been gathering from students at Togetherall and what just drives your passion. Uh, Hopefully, the audience here has gotten just a quick sneak peek look at why Upswing is so excited to have the opportunity to work with Togetherall here. And if there is any interest in wanting to learn more about this, you can certainly feel free to reach out to us. Our emails just speak@upswing.io. And we'll be happy to forward your questions or forward your information to um, the right places there. And then I also see that Elena shared some information down here below as well. But other than that, we thank everyone for attending today, learning a little bit, hopefully. And we look forward to seeing you at the next webinar. Thanks everyone for your time and have a great rest of your afternoon.
Thanks, everyone. Thanks, Melvin.